HER2 and gastric cancer. You've probably heard of HER2-positive breast cancer, but 20 to 30% of gastric tumors are HER2 positive. So what does this really mean, and how might it affect your treatment? The HER2 gene, short for human epidermal growth factor receptor 2 gene, provides the recipe for making the HER2 protein, a receptor that sits within the surface of certain cells. When these receptors pair up, they generate a signal that can tell a cell to divide. In healthy cells, these signals are regulated. There are 2 copies of the HER2 gene, and they produce just the right number of HER2 receptors that the cell needs to function normally. In cancer cells, however, the cells sometimes have extra copies of the HER2 gene, known as HER2 gene amplification. These extra genes can direct the cell to make way too many HER2 receptors, called HER2 overexpression. Tumor cells with HER2 gene amplification, or HER2 receptor overexpression, are called HER2-positive cells. HER2 overexpression causes so much receptor pairing and cell signaling that the tumor cells are constantly being triggered to divide. This uncontrolled cell division can drive tumor growth. Drugs that target HER2 receptors can stop cancer cells from dividing, and some can also alert the immune system to destroy these cells. Ask your doctor if your tumor was tested to learn its HER2 status. If it was, ask what it means for your care. If it wasn't, request that a sample of your tumor be sent out for biomarker testing that includes HER2. You and your doctor are a team in your care. This video is for informational purposes only and is not intended to be a substitute for medical advice. Talk with your doctor to decide the right course of treatment for you.